All right, guys, let's just get it out there. I am having a bad hair day and I could go and have a shower and dry and style my hair, but by the time I would be done, I would have no energy to film this video. So let's just forget about this, okay? Today I'm here because I want to give you a little health medications update. I've had a few people comment in some of my videos asking for an update and specifically medications updates. So this is what we're doing today. So welcome back to today's video. If you're new to the channel and this is your first video that you're coming across, I'm Daniela and I live with multiple chronic illnesses. My first chronic illness to be diagnosed was fibromyalgia. And I was diagnosed with fibromyalgia about 34 years ago. So I've dealt with it for a really long time. And after that, I was diagnosed with IBS. And I think a lot of people that have fibromyalgia also have digestive system issues. So I don't think that's that uncommon. But yeah, I've dealt with IBS for a really long time. And then in the last 7 to 5 years, the other chronic illnesses came along. I was diagnosed with chronic migraines, and that came after a fall. I fell down the stairs, hit my head, split it open, and developed severe concussion. And honestly, I don't think I've ever been quite the same since I've had this fall and this concussion, especially when it comes to stimulation, like sound, lights. So guys, today is a beautiful sunny day and I am filming with natural light. So you're gonna see a lot of fluctuations because there are a few clouds coming here and there, so you may see it getting brighter and less brighter. The camera does adjust a little bit, but you will see difference in lighting. I hope it is not too distracting, but we're just gonna keep on going, okay? This is the second time I'm recording this video. I recorded for an hour yesterday, only to find out after when I was reviewing the clip that after 10 minutes of talking, my microphone died and then I had no sound for the rest of it. So here we go again, take two. So anyways, after the chronic migraines, I developed POTS, postural orthostatic tachycardia syndrome. And I believe that that was as a result of getting COVID. I think I already had the genetic predisposition because when I was pregnant with my children, I had all of the POTS symptoms. I just didn't know it was POTS. So what happens with POTS is that whenever you change your position, especially from a lying or sitting down position to standing, your heart rate goes extremely high, more than 30 beats per minute, but also you get a lot of other symptoms. You can get nausea, headache, dizziness, pass out, all sorts of different symptoms. I do have a video on POTS and I'll link it in the description below if you want to check it out. So I think that when my body is under a lot of stress, and pregnancy is a lot of stress on the body, my body can't quite compensate and the autonomic nervous system gets very stressed out and imbalanced. But after I delivered the babies, I was fine. I was back to normal. However, after getting COVID, I never went back to normal. I developed severe POTS to the point where I was fainting, passing out. My heart rate would go to over 200 beats per minute. And yeah, it was not a fun time. I was feeling extremely unwell. I got COVID like 3 times and that had a huge toll on my system. And shortly after that, I also developed MCAS, mast cell activation syndrome. And basically what that is when your mast cells, which are cells of the immune system, those cells are responsible for releasing chemicals that act in a certain way, and it ultimately is meant to help you heal and protect you. But if they are overactive and they are being activated for no good reason, it can make you really sick. And I was actually having anaphylaxis reactions. And what caused those reactions? nobody really knows. I couldn't tell. Each time was a different thing. So it's not like you are allergic to something and your body has a reaction. It's just your mast cells getting out of control for whatever reason. It could be overexertion. It could be being in an environment that is too noisy or with bright lights. It could be a medication that I took. It could be a certain food, a food that I've always eaten before and now I'm getting a reaction. It could be stress. It could be like literally anything. It could be cold, like difference in temperature or too much heat. It's just insane. You never know when it's coming. And I was having full-blown anaphylaxis reactions, ending up in hospital, and nobody really knew what was causing it. And that is so scary because when you're allergic to, let's say, peanuts, you avoid peanuts, right? But when you don't know what your body's going to react to, it's pretty much impossible to avoid life. And it would come out of nowhere. It would happen like in the middle of the night. I am sleeping, fast asleep, and then I would start coughing and throwing up like out of nowhere. It could be skin, I could get rashes, it could be, a lot of the times, it had to do with my digestive system. It was stomach pain, throwing up, a lot of mucus and phlegm production that would get caught in my throat and make it difficult to breathe. Migraine, like instant, severe migraine. It's like awful. Like you literally fear for your life. And so I dealt with that for a couple of years, waiting to see specialists, waiting to get diagnosis, trying to understand what was going on. Those were really difficult times, also because it was COVID time, it was lockdown, hospitals were so hard to access, doctors were hard to access, and all the masks and all the precautions that just added fear and stress to the situation. And then at this point, I'm also going through perimenopause, and I started to develop a lot of back pain. I have back pain from fibromyalgia, but this was a different back pain. Fibromyalgia for me is more of either a generalized pain, like when you have the flu, like a nerve pain, a burning pain. You can't really tell where the pain is. Everything just burns and throbs and aches. Or it could be very localized, a muscle knot, like a trigger point where that part of the muscle is extremely sore. This pain I was experiencing was different. It was a pain that felt deep in the bone, and it was very localized. It's either between my shoulder blades or in the lower back. So there were two spots. And then just as I entered menopause, I developed uveitis. Uveitis could be an infection or inflammation of the uveus, which is a part of the eye. And in my case, there was no infection. It was just a massive inflammation. And they discovered that what caused my uveitis, which nearly costed my vision, I had vision loss for almost 6 months. I am very lucky to have recovered my vision. The doctors told me that I would not recover my vision. So many people lose their visions to uveitis, and I know how lucky I am to have recovered my vision, and I'm so thankful. But they discovered that what caused my uveitis was my body attacking itself. It was an autoimmune cause, which led to a whole investigation, and I ended up being diagnosed with 2 autoimmune disorders. The first one is non-radiographic spondyloarthritis, and this is what was causing the pain in my back. I also developed plantar fasciitis that for 3 months I could barely walk, and that's also related to the spondyloarthritis. And I also had bursitis on my left shoulder, which is also related to the spondyloarthritis. And then soon after that, I was also diagnosed with lichen sclerosis, which is an autoimmune disorder that attacks your skin cells. So yeah, lots of stuff going on. The last 5 years have been really tough because there has been a lot of new things that I'm having to deal on top of the fibromyalgia, on top of the migraines, on top of the IBS. And it is just hard to juggle multiple chronic illnesses because there's always something flaring. You may be doing well with one, but then something else is gonna flare. Or sometimes they all decide to flare at the same time, and it is just hell. All right, so that is just a little bit of a sum up of all my chronic illnesses. So how am I doing regarding all of these chronic illnesses? So for the fibromyalgia, I am actually doing pretty good. The last 3 months of 2024 were really hard. I was not doing well at all. I was struggling. I was in so much pain, and flares were just coming one after the other, and I didn't even see them coming. It was like I was just recovering from one and it was like down again. This year has improved significantly, and I usually don't do well in the winter, so that's quite surprising to me. But I think there's a few things that could have contributed to that. The first one, I am being a lot more consistent with taking vitamins. I am taking vitamin D, zinc, and magnesium, as well as this multivitamins for menopause. And I have never been consistent with taking vitamins in the past. I always forgot them. But what I did this time is when I'm sorting out my medications for the week and I put them in pill organizers, I put the vitamins with them. So when I go take my medications, I would take the vitamins as well. So I think that has helped. The other thing that has helped is I have been outdoors a lot. I have been doing a lot of walks, so not only I've been more physically active, I have been getting a lot of fresh air, a lot of contact with nature, and so I haven't felt as much as the cabin fever and sort of like depression of winter. So I think that has helped. Getting outside, breathing fresh air, being in contact with the cold, and not just being like in a house breathing the same air over and over again. I think that has made a difference. The other thing too is I have not traveled in a plane this winter. I usually go away to warm places in the winter, and planes are one of the biggest triggers for me for fibromyalgia. Not only because of how tough it is physically, I usually do long flights in airports, but also it is so much easier to get sick, to get like a virus, because you are stuck in a metal box with 300 other people breathing the same air. And whenever I get sick, my fibromyalgia flares immediately. It is just so much harder for me to be sick because the pain just becomes out of control. So I think between the vitamins, exercise, being outdoors, not being exposed to viruses, has really helped keep my fibromyalgia under control. Now, having said that, I am going to Costa Rica in a few days. So yeah, I will be on a plane. We'll see how that goes. I will let you guys know. For the POTS, it has also been much better, but not only for the last few months. My POTS has been generally better for a really long time. I have done a lot of physio for my POTS. I am not taking any medications for my POTS. The only thing I do is I do generally put more salt on my food. I drink a lot of fluids, and now and then I wear compression stockings. So those are the things that I do to manage my POTS, and keeping physically active, like doing the physio and going for walks. One thing again that really triggers my POTS is again getting sick. So viruses are just like the catalyst for every symptom and every chronic illness. My heart rate is still higher than a normal person, just like my normal baseline. But also when I do go for walks or hikes or go up the stairs, it goes significantly higher than a normal person. It goes to like 150. If I'm hiking, 165, 170. But I am not getting the symptoms other than feeling that my heart is racing. I am not getting dizzy. I'm not getting nauseous. I'm not getting the headaches. I am not passing out. So that makes a huge difference because that allows me to continue walking and doing all the conditioning that helps to manage POTS. Now, let's talk about the mast cells. The mast cells have been generally better, but I have still had reactions. I had a few times where I woke up in the middle of the night coughing. If I catch a reaction very, very early on and I take Benadryl, which is an antihistamine, it will prevent it from developing into a full-blown reaction. They have been happening, but they have been happening much milder, and I've been able to get them under control much quicker, so I don't actually get to the point where I'm throwing up and coughing so violently that I'm pulling every muscle in my body and triggering like a fibromyalgia flare after. I still need to take lots of medications for that. I take a lot of antihistamines, which makes you very tired. So my fatigue has been tough. I've been tired, and I know that a lot of it has to do with the side effects of medications I take, but I think also winter, right? Like the lack of sunlight, and yeah, I think it's a combination, but fatigue has been tough. I really have to push myself to do things, or I would just lay on the couch all day. Talking about mast cells, I want to give Megan a shout out. Megan is one of my subscribers, and she sent me this little card. It was so sweet of her, and she sent me a few bookmarks. She makes these and she sells them at her shop, and this one speaks so much to me. Owner of dramatic mast cells. Oh my gosh. When I saw that one, I'm like, this is it. This is exactly it. I have dramatic mast cells. That is a perfect explanation. And then she sends a few other ones. This one here, I look fine because migraines are invisible. Lots of drugs club. Owner of psychotic automatic nervous system. These fit me so well. She must have been watching my channel for a really long time because these are just perfect for me. She has lots of other ones on her shop. If you'd like to support another chronic illness warrior, I will leave the link to her shop in the description below. So just go and check it out. You know, she has really cute bookmarks there. So for the non-radiographic spondyloarthritis, that has been hard. I have been in a lot of back pain. I feel the pain is getting worse. Nobody's taking it seriously because it is non-radiographic, which means you can't see it on an MRI or an X-ray. The non-radiographic spondyloarthritis is part of the ankylosing spondylitis umbrella. Ankylosing spondylitis is when the disease is very advanced and there's spinal fusion. I don't have spinal fusion. Because I'm already 50 years old and I don't show anything on X-rays and MRIs, and because I am a woman, it is less likely that I will ever end up with spinal fusion, thank goodness. But that doesn't mean that I am not in excruciating pain. So in a way, that kind of works against me because I don't qualify for the treatments that could potentially help a lot with my pain. And I have fallen in love with hiking. I absolutely love walking in nature. And I have been doing a lot of hikes in the winter. And I think that is what has helped me keep the fibromyalgia more at bay. But on the other hand, it has made my back pain so much worse. Every time I do a hike, I am in so much pain. And if I do a hike that is a little bit more strenuous, a hike that I did the other day, we didn't realize that we had so much snow the day before. So when we got to the hike, it was almost like knee deep. And hiking on those conditions, having to really pull your leg and give a big step, and we didn't have snowshoes, it really messed my back. And I was literally in bed crying in pain for like 5 days. I have gone hiking after that, and I am in a lot of pain every time after I hike. And it's just so sad because I absolutely love hiking and I want to continue hiking. So I'm going to talk to my physiotherapist and see if there's anything he can do to help me, if there's things that I can do to strengthen the muscles around the spine there, and maybe if they're stronger, they will support the spine more and put less strain on the spine, because I really, really want to continue hiking. And then for the lichen sclerosum, I am on a preventative treatment. I use an ointment, and I have to do it once a week. And if I forget, which I often do, because once a week is a habit that is difficult to remember. When you do something every day and you do it every day at the same time, it's easier to remember. But when it's just like once a week, it's kind of harder. So I forget a lot, and then I flare up, and then I have to use it for like a week until it gets better, and it can take up to 2 weeks to get better. So I'm trying to get better at remembering doing once a week. I need to tie it to another habit to kind of remind myself. I've tried reminders on the phone. That doesn't work because I often have my phone on vibrate. Anyways, I'm figuring this out. So anyways, let's do a little medication update, because I've had a lot of requests of people wanting to know what am I taking now and what's helping and what's not. But before I do that, I just wanted to let you guys know that I have started a Buy Me a Coffee page. This is a platform where people can support their favorite creators. You can give donations, like a once-off donation, or you can do a membership and you can support me on a monthly basis. Basically, it's just a way for those who are in a position to do so and are wanting to do so to help me create those videos, because they do take a lot of time and energy out of my day. And whenever I am doing those videos, I am not doing something else, because they really drain a lot of my energy. So filming day is like my whole day is done. It's all about filming. So if you'd like to support me, I'll leave the link in the description below and you can just go and check it out. But for medications, I have my medication bag here. So this one is the, I don't know if you can see, Menopause vitamins. So before I go into the medications that I use to manage each condition, there is 2 medications that I use that kind of just help everything overall. And that is hormonal replacement therapy. So when I entered menopause, a lot of things flared. I developed 2 autoimmune disorders as soon as I entered menopause. And part of it is because when you enter menopause, your estrogen levels drop, and estrogen is very protective against inflammation. So basically, once I had this protection gone, my inflammation just exploded. And everything got worse: the fibromyalgia, the POTS, and the autoimmune disorders, and the uveitis, and all that. I know that hormonal replacement therapy is not for everyone. There are contraindications. Fortunately, I don't have any contraindications. I know there are risks associated with it. For me, the benefits that I'm getting, including preserving my vision, outweighs any risks. So for hormonal replacement therapy, I use a gel. This is estradiol, so it's an estrogen gel, as well as progesterone pills. I use this every night, and not only it has eliminated all of the hot flashes, irritability, loss of libido, all of those things, this is all gone. It has really helped with a lot of the other symptoms. This one here is low-dose naltrexone, also known as LDN. I have been taking this for a really long time. I don't know, maybe 15 years, 12 years, a long time. And I take this for fibromyalgia. If you'd like to know a little bit more about it, I do have a video on this medication. I'll leave the link in the description if you'd like to check it out. But if I don't take this, my fibromyalgia pain gets to a point where I am bedridden. So I've been taking this for a long time. It really makes a difference. Does it make it go away? No. Do I still have flares? Yes. But without it, it's so much worse. This one is a muscle relaxant. It's called tizanidine. And there has been times where I was taking it daily. I take it at night because it makes me very, very drowsy. I can hardly keep my eyes open when I take it. But now I only take it after hikes. I only take it if I feel that my muscles are angry at me. So I use it on a as needed basis. Okay, what else we have here? Okay, the next one is an anti-inflammatory, meloxicam. And I think it helps for fibromyalgia as well, but this was primarily prescribed for the spondyloarthritis. And again, I have tried to stop taking this because it was really upsetting my stomach. Any anti-inflammatory taken on a long term will mess up your stomach. And so I tried to not take it. And again, I was bedridden. So I will continue to take as long as I can tolerate it. What else do we have here? Okay, so those two here are antihistamines. This one, hydroxyzine, it's an H1 blocker, and this one, famotidine, is an H2 blocker. And those two together is what help my mast cells stay under control. The hydroxyzine also helps me with the fibromyalgia. I actually started taking this even before I had mast cell activation syndrome. But the famotidine is actually, I think, it's not an antacid, but I think it's for acid in the stomach. And so it helps with the issues that I was having with the anti-inflammatory, but it also is an H2 blocker, which is a histamine blocker. And so it helps with the mast cells. So 2 antihistamines. This one is a sleeping pill. It's called Zopiclone, and I cannot live without this. I know they're addictive, but I have such bad sleep disturbance, and I hardly get any deep sleep if I don't take it. And sleep deprivation or non-restorative sleep is one of the biggest triggers of fibromyalgia flares for me. So it is super, super important for me to get sleep, and this medication does that. I would like to change it because this particular one has a few side effects. I mean, they all do, but they are really bothering me. One is it leaves a extremely bitter taste on your mouth. So I am compulsively eating for like half an hour after I take it until pretty much I fall asleep. And this has resulted in me falling asleep a few times without brushing my teeth, which is not good. And also to weight gain because I'm eating a lot just before bed. And I also wake up quite foggy and drowsy the next morning. So yeah, still, like, if there is no better option, I feel I have no choice other than continue taking this, because I have tried to not take it and it is an absolute disaster. But if I can try something else that has less of this bitter taste and doesn't leave me so foggy in the morning, I would like to try that. So I need to bring this up with my family doctor and see if we can improve this situation. For the migraines, I take an injection called Emgality. This injection I take once a month, and it has changed my life. Before taking this injection, I had hit a point that I didn't want to live anymore, that I couldn't live anymore. It was excruciating. I was in the emergency room every week. It was one of the hardest times of my life. This injection was one of the last things that we could try for my migraines. I had tried everything else before that. I had tried Botox, I had tried magnesium infusions, cannabis, medications, antidepressants, abortives, like you name it, I had tried and nothing had worked. And I was losing hope. But this medication saved my life. And so I take that on a monthly basis. It really helped. It almost eliminated my migraines for almost a year. And then now it's not working as effective. I am getting, I don't know, maybe 10 migraines a month, but I am able to get them under control using this medication, which is elytriptan, which is an abortive medication. That alone doesn't work, but if I am taking the injection and then I have a breakthrough migraine, then now this works. The problem with this is that it makes me extremely fatigued, and it takes about 2 hours to work. So I still have a few a month where I have to take it, and it makes me so tired. And it, there is a couple of hours that I'm in a lot of pain, but it has definitely been a lot more manageable than it was before. And then I have a couple of medications that I use for severe pain, and those are opioids. I have always taken oxycodone for extreme pain. The problem with that is that I'm slightly allergic to it, and it gives me a rash, and this rash turns into sores. So if I just take one, it's fine, but if I take more than one, like in a row, I will definitely end up in sores. So it was always making that decision of like, okay, I'm going to get a break from the pain, but now I'm gonna have to deal with those sores that it's going to take weeks to heal. So it wasn't ideal. And then at the pain clinic, they switched to tramadol, which is also an opioid, but not as strong as oxycodone. And it does not give me a rash, so that is amazing. It doesn't work as well as oxycodone, so depending on how bad the pain is, I might still need to take oxycodone, but I always try to take the tramadol first. But I have to say that I haven't taken very many lately. I was taking like about 10 a month. That has always been my average. And I think I'm taking like 2 or 3 now. So I have considerably reduced it. What else do I have here? Benadryl. Benadryl is my rescue medication for my mast cells reactions. Okay. Oh, and then there are a couple of eye drops. Often I start to get a bit of a flare in my eyes, and I do believe that they are related to the mast cells that are attacking my eyes. And so I use this eye drop. It's called Crumlin. And basically what it is a mast cell blocker. And so it really helps with my eyes. But if that doesn't work and my eyes are still flaring and they're getting sticky and they're getting sore and I'm getting blurred vision, then I have a steroid eye drops, and I only use that if I can tell that I'm getting a uveitis inflammation, because steroids have side effects, and they can be dangerous medications. You can't stop them cold turkey, you have to titrate, and anyways, this is emergency only. And I think this is it. That is my new updated medication list. So this is it for today, guys. I want to say thank you again, Megan, for sending me those beautiful bookmarks. Give this video a thumbs up, give it a like, and I will see you guys in the next one.